As students head back to class, health officials are preparing for a potential triple threat of respiratory viruses, and that includes COVID, RSV, and the flu. Dr. Eric Chow, King County's Chief of Communicable Disease Epidemiology, that's a mouthful, is live here this morning with us to prepare for these fall viruses. Dr. Chow, good morning to you.
Good morning. Thank you for having me.
Now, last year, health officials around the nation were concerned about a triple-demic, and we've talked about it this year as well, COVID-19, RSV, and the flu. So what is the real threat level heading into flu season this year?
Let me just say, I am very concerned about experiencing another season like we did last year, where just so many adults and children were sick with RSV, flu, and COVID. In addition to the health impacts, this puts a lot of strain on our healthcare systems. It's hard to predict exactly what the timing will be this year, but usually around the time school starts, infections pick up. And we have already seen a rise in COVID numbers here locally.
But thankfully, the pandemic is behind us. What can we expect from COVID in the coming years?
You know, that's the thing about COVID is that it can continue to throw curveballs. And so since the beginning of August, we've actually already seen a consistent increase in COVID-19 hospitalizations, which makes me very concerned about the actual total number of infections in the community. And as people stop taking the same precautions they once did at the height of the pandemic, COVID will spread more easily. But the good thing, though, is that the same layered approaches that we've been taking to protect us from COVID-19 are still relevant today. And this includes staying up to date with recommended vaccinations, wearing a well-fitting, high-quality mask in indoor public spaces, and improving indoor ventilation.
So do you think... I'm sorry. No, go ahead, Dr. Chow. I'm sorry. I cut you off.
I was just saying, for those people who get an infection, you should get tested and get treatment early if you are eligible.
So do you think kids should be wearing masks in classrooms?
You know what? For my family and friends who have young children, I am concerned that that is a place where people can get infections. I would advise them to go ahead and continue to wear masks in those settings.
All right. Well, so we've talked about long COVID as well. Do we see any patterns in long-term effects from COVID from your standpoint?
Yes, unfortunately, long COVID or post-COVID-19 conditions are long-term symptoms that can affect people after COVID, and this can affect people of all ages, including children. So even people with mild infection can have these longer-term symptoms, hence why it's so important to protect against infection in the first place.
Gotcha. So what are your official recommendations for the flu and COVID vaccines this year?
Yeah, so for COVID vaccines, we continue to recommend all people who are eligible, that's 6 months and older, to go ahead and get up to date with the recommended vaccinations. We anticipate that a new booster is going to be coming out in the next couple of weeks, and CDC will continue to provide guidance around that, and we continue to recommend that people stay up to date with that guidance. For flu vaccines, people should go ahead and get that flu vaccine annually for all people who are eligible. Again, that's 6 months and older.
King County's Chief Epidemiologist, Dr. Eric Chow, thanks so much for your time. We appreciate it.
Thank you.